I want to appreciate you one more time for your time with us on New Dawn Otojo this Monday morning. We're talking about medicine this time around, and we're being joined by two individuals who are in the practice. We're talking about Mansac Training Week, the first for the Federal Medical Center here in Abeokuta. And when we talk about Mansac, we're talking about Medical Association of Nigerians across Great Britain. There are Nigerians who are actually doing the nation proud in foreign land, particularly in Great Britain. And so they are here to offer training for 1 week for practitioners here at the Federal Medical Center in Abeokuta as a way of helping humanity do more in the area of healthcare delivery. We're being joined this morning by the president of the Medical Association of Nigerians across Great Britain, Mr. Jacob A. Akoh, and the medical director of the Federal Medical Center, Idaba Abeokuta, Dr. Dapo Shotinoye. Gentlemen, good morning.
Good morning.
Good morning.
It's nice to have you with us.
Good morning, viewers.
Now, I should start with you. Life as a diaspora Nigerian in the field of medicine in Great Britain is quite awesome or challenging?
Maybe both. First of all, it's a pleasure to be here this morning and to be part of this discussion. It gives us great joy and privilege to be in Abeokuta for what you call the first Mansac Training Week.
So far, so good. You've been in Abeokuta for when?
We came yesterday.
And so between yesterday and today, you don't want to return to Great Britain, do you?
The diplomatic answer should be no. Life is complex, and sometimes a lot of variety brings joy and enriches your experience. And so I think sometimes it's good to look at it from both ways, that there is a lot we can benefit from being here, and there's a lot we can benefit from being there. And having people here and there and interacting will improve the final product.
Now, Mr. Akoh, what competencies are you bringing from Great Britain in terms of medicine to impact on your contemporaries here in Nigeria, particularly at the Federal Medical Center with respect to this training, which is the first in this series?
Right. It's a very complex question. I'll try and break it down a bit. The first thing to say is that the Nigerian medical professionals in the diaspora in the United Kingdom number about 5,000 doctors. That's a huge number compared to the number of people in this country. And amongst the 5,000, there are people at various levels of expertise and experience. There are people at the very top of the profession who can hold their own with anybody in the UK. There are people who are climbing the ladder, as it were, and there are people who are starting. And of course, we got people in medical school, the so-called leaders of tomorrow. So the Medical Association of Nigerians across Great Britain is meant to be a broad church that brings everyone together so as to improve their quality and experience in life, in the profession, and to give them the best opportunities to climb the ladder and become the best they can be. And one of our critical aims is, apart from helping each other over there to succeed and be the best, is to improve healthcare delivery in Nigeria. And we do a lot of things, I'm sure you're going to ask me later. And one of the key issues is about transferring knowledge and skill. And not for 1 minute am I suggesting that there's no knowledge in Nigeria, there's no skill in Nigeria. It's about improving this, about redirecting this, making it more effective, and helping brothers and sisters, as it were, here to. And let me also add that this training week is being hosted by the Federal Medical Center in Abeokuta. The aim is for people, doctors from other areas in this country, who can travel, who are able to travel to Abeokuta to join us. And hopefully, during the course of the week, we will have doctors from other places coming. But obviously, because FMCA, Federal Medical Center Abeokuta, is the host, they're entitled to get the richest benefits of it.
Now, Dr. Shotinoye, you are the host of this all-important convergence. How receptive are you and your contemporaries in the profession here in Ogun State are going to be to this wonderful opportunity?
Oh, thank you very much, moderator. Actually, we are the one looking for this. We actually started this process as far back as 2010 because we wanted a situation that you can actually convert the brain drain that we have in Nigeria to brain gain, whereby people who have gone abroad can actually bring back the expertise that they have acquired and impact on those of us here at home. And the training that we are talking about now is not just for Federal Medical Center Abeokuta alone, it's for the whole country. Resident doctors across Nigeria, young consultants, people who actually want to improve their skill and their knowledge in their different fields have been invited to join us. And this is the first of its kind in Nigeria. And we hope to do this regularly on a yearly basis. We'll be focusing on different areas of medicine, different specializations, different specialties. And people who are top flight in these areas in Great Britain are coming to impact on us their skills and their knowledge. Now
let's talk about specifics now. What core areas are you expecting to be impacted on via this first training week?
Well, this first training week we will be focusing on emergency medicine, internal medicine. We'll be focusing on obstetrics and gynecology, the new developments in the field of obstetrics and gynecology, in the field of surgery, in the field of ophthalmology, orthopedics. These are the areas that we are focusing on for this particular training. And in the coming year, we'll be going to other areas. And we have the best brains in these areas who are Nigerians practicing in Great Britain, coming to Nigeria to assist us, to impact on us.
Now, Mr. Akoh, I'm sure you have so much that you are bringing on the table in terms of the specifics that I just asked Dr. Shotinoye of. What areas are you particularly focusing on for a start?
Thank you for the question. I think we're being pragmatic that even in the United Kingdom or in America, most doctors are required to update their skill, their knowledge on a regular basis. What is called continuing professional development is just now taking root in Nigeria, which means you never arrive at a point where you feel you've got all the knowledge you need and therefore don't need to go for any course. In fact, it is really bad medicine for you to think you've arrived at that point. And if you've graduated from medical school and you've never gone for any courses apart from what you were taught in medical school, you're a dangerous doctor. And I say that with any equivocation. So that's the first thing. Now, this next thing is what is possible, what is practicable in terms of this year. What's the greatest need? Who are the people available to come? Like I mentioned earlier, we have a large number of specialties and specialists, but not everybody will be available to come at any particular time. This year, starting it is a bit of experimental in the sense that we've come to do 3 main courses and what we call a generic course. The generic course is the focus on basic resuscitation technique, basic life skills, trauma care, things that any doctor should know. What you do in an emergency situation to resuscitate people who are injured or damaged or whatever. And hopefully, on Wednesday, when all the members attending the various different courses are available, we can have a large number of people who will go through the process of what we call basic life support, how you actually take care of people in that situation. So actually, once you've done that course, you're given a certificate to show that you've been trained in how to support people who are either severely injured or who are very unwell. Right. Now, we've got the medical course and aspects of it, highlighting some of the latest developments in various areas. What we have done in Mansag this year is to bring people at the top of their game in the various specialties. so that they can come and share their experience and also see how we can improve what goes on here. The title or the theme is what is new, what's relevant to Nigeria. So we're not just going to vomit a lot of new things, but in the process also see how we can apply some of them here. And the other key issue about the training week this year is that we've got a home-based faculty too, who are interacting with us so that we can deliver a whole message to the people who are undertaking the program. So we've got issues in medicine, in surgery, and in obstetrics and gynecology. And like my friend said, next year, if we're coming back, we'll have a different angle to it. But the aim is always to plan and develop what will be relevant to the people.
Now, talking about what will be relevant to the people, Dr. Shetinoye, you will also agree with me that Nigeria and indeed West Africa has a challenge on our hands now with respect to the Ebola virus outbreak. Now, if we're talking about delivering what is peculiar to our situation to us in terms of healthcare, I'm sure this is one good opportunity for both the local faculty and the diaspora faculty to interface as to how best, maybe from this conference or maybe from this week, you would be the one that will be win the next Nobel Prize for health. An outright discovery that could actually nip the Ebola virus in the north.
Well, thank you very much. The Ebola virus is not a new virus. It's a virus that has been discovered as far back as 1976, when the first outbreak came up in the Republic of Congo, which we used to call Zaire at that time. It's not something new. What we are actually looking at is a vaccine that can actually take care of the disease, or drugs that can actually kill the virus. And research are ongoing to actually find this. But what is more important, like I said at another forum, is that how can you protect yourself? How can you protect people around you? How can you limit the flow of that virus from whoever is infected to somebody else, or to yourself, or to your family? That is what we are really focusing on. And the moment we are able to actually win with that, we will put that virus where it belongs, and we can actually intensify the research that is required to get to the roots of all this problem we are talking about.
Now, we're talking about this BANSAC training week with FMC being the facilitator for now for the first edition. Yeah. Now, let's talk about the participation and the program itself. Where is it taking place? What is the scope of involvement?
Well, the program is taking place at the Green Legacy Resort, that's at the Obasanjo Presidential Library Complex. And the scope is actually not just limited to doctors in Abeokuta or doctors in Ogun State. It extends to the whole federation. Our colleagues all over the country have been informed, and they are coming. So many people have registered, and we're expecting a full house. Resident doctors, young consultants, and people even among the old ones who actually want to improve their skill and their knowledge. They are welcome to join us. Since this program is going to be an ongoing thing, we don't expect it to be limited to the 3 areas that we are focusing on now. The next opportunity will move on to another area which are very topical areas that we can actually develop the skill in Nigeria to actually measure up to what is expected internationally. Now,
talking about the peculiarity of the Nigerian situation with respect to healthcare delivery, primary healthcare is quite essential and very unique with the Nigerian environment. And if you like the African continent, I'm sure it may not really understand our terrain here, but it cannot be totally alien to our terrain. Are you also allowing opportunity for involvement at this level?
No, there is a lot of involvement. That's involvement. The government of Ogun State is involved. The Honorable Commissioner will be at the opening ceremony, and they are also sending their own doctors to this training. Primary health is the responsibility of every doctor. It's not just for the community physician and the primary care specialists. Every doctor must actually know how to protect, to prevent spread of disease and to prevent communication of disease. Those are some of the things that we know. And it's not just limited to those of us in Africa. Even people in Great Britain, we are all equipped in these areas, and we are going to impact on other people around us.
Now, given the fact that you've been away for some time, I want to admit that you also may not be alien to primary health care, so to say.
Definitely not.
But the peculiarity of Nigeria's situation, vis-a-vis this particular aspect of medicine, public health management, is what I want us to take a look at. Primary health care in Nigeria. Is this training also likely to expose us to how we can up our game as it obtains in developed economies like yours?
All right. Thank you very much for your comments. The first thing I want to say is that actually the first lecture this year is on primary health care.
Good.
How to investigate epidemics. All right? And the aim is to encourage doctors to begin to think outside the box. And not just, oh, this is my area, and therefore I'm not interested in what happens in other areas. So that's very much in focus. And on Wednesday afternoon, half of the people hopefully will attend what is called a research methodology course. Again, to get people thinking about what is useful research. What type of research do we do currently? What is useful? What has been the output? How should we be doing it differently? How do others do it? So that's part of it. So part of the program, the basis for the training week, is to inculcate in people a generic attitude to knowledge acquisition, to skill and knowledge transfer. And you don't measure it by, oh, I know the answer to 10 of these questions anymore. It's about the life skills you've obtained that you can use to improve your life. And now, to address your specific issues about whether we are aware about what's going on or not, we are very aware. I, for one, for example, come to Nigeria every year.
That's great.
I've done that for the past 15 years, and sometimes come 2, 3, 4, 5 times in a year. And we're very aware about what is going on and have been very involved with the Federal Ministry of Health in trying to develop policies to improve healthcare delivery in Nigeria. Although we don't live here every day, we have family here. We're concerned. All the people are people we trained with or know somehow. So there's that level of interaction. This year, for example, the MANSAG conference in Cardiff, the main theme for it is Millennium Development Goals, MDGs. How did we fare? Because next year is the end of the first phase.
Okay.
And then we're going to look at what happens after next year. We're bringing people from primary care in Nigeria to the UK to be part of that discussion. We've invited all the state commissioners and leaders of the medical directors and chief medical directors of various institutions for us to look at how we can position Nigeria going beyond 2015 in terms of Millennium Development Goals. And most of the Millennium Development Goals are primarily healthcare orientated. So we're not just living in some ivory towers and thinking high-tech medicine, but actually, if you provide water for every Nigerian, you will have the disease burden. We all appreciate that. And hopefully, in the process of our interaction, impart that aspect of knowledge to or reawaken it in our colleagues.
Our guest this moment are two gentlemen who are medical practitioners. We have Mr. Jacob Akoh, who is the president of Medical Association of Nigerians across Great Britain, and the medical director of the Federal Medical Center, Idaba Abeokuta, Dr. Dapo Shotidoye. We're talking about the first in this series of the MANSAG Training Week for medical practitioners across Nigeria. And if you like, the West African sub-region, if any of them could find its way to this place, being hosted by the Federal Medical Center, Idaba Abeokuta, the essence is to up the game in terms of knowledge base of medical practitioners in this country. And we take this short break. When we return, we shall be throwing the lines open for you, perhaps as a practitioner, as somebody who's a stakeholder in healthcare management in Nigeria. You may wish to have one or two inputs as the process continues. Just stay tuned. We shall be back to allow you make your own contributions to the discuss.
Cleaning our environment shouldn't be a once-in-a-month chore. Don't wait for the last Saturday of the month to do this. A clean environment is a healthy environment and a civic responsibility.
Breastfeeding is one of the most effective ways to ensure a child's health and survival. It also guarantees your child a high immunity rate. Adequate breastfeeding could save many young lives. Exclusive breastfeeding is good for your child.
We thank you, Steve, for your time with us on New Dawn Otojo this Monday morning. We're talking medicine, and we have two guests with us here. The first is Mr. Jacob A. Akoh, who is the president of the Medical Association of Nigerians across Great Britain, and Dr. Dapo of the Federal Medical Center, Idaba Abeokuta, the medical director of that institution. We're talking about the first Medical Association of Nigerians across Great Britain training week for medical practitioners in Nigeria, with the Federal Medical Center, Idaba Abeokuta, as the proud host of that week. We also want to enlist your contributions now. You can just pick your phone and call in case you have something to clarify or you want to make further inquiries about how you can be part of the process. The telephone numbers through which you can interface with us will soon be displayed on your television screen so that you can be part of the discourse. Now, Dr. Shotiloye, I want us to talk about the healthcare insurance schemes we have in Nigeria. The National Health Insurance Scheme is one thing. The Ogun State government only recently facilitated what is called Community-Based Health Insurance Scheme. Are we having such schemes functional in this part of the world? I want to believe, if I'm wrong, kindly correct me, that health insurance schemes are quite essential to effective health management in any country.
Well, thank you very much. Health insurance is actually the way of financing health as opposed to the out-of-pocket financing. As a matter of fact, no nation can actually succeed with people financing their own health from their pocket. Health insurance is a way of actually getting these people, the rich, to actually partner with government to take care of the poor. We want a situation that when you are ill, there will be enough provision for you to take care of you wherever you are, or whatever your level. Whether you are in the village, whether you are in the city, whether you are in the federal capital, wherever you are, and whoever you are, whether you're a male or female, and whatever your age, you should be able to access health. And if we actually imbibe this culture of health insurance, like it's done in other parts of the world, people don't need to be afraid when anybody falls ill or takes ill in any way. You quickly get to the hospital and you are taken care of at a cost that is borne by the insurance company. This insurance company, you are not paying so much money, it's just a little token. It is such that the present thing that the NHIS is actually doing is that you can actually access health by paying 1,500 for the whole year for one individual. And that means if you have a family of 4, for example, you pay 6,000, and for the whole year you are covered. Any hospital that is actually enrolled in that healthcare insurance takes care of you to any level, and the bill is taken up by the insurance company.
I'm sorry to cut in here. We have our first caller here. Hello, good morning.
Hello, good morning.
Good morning. What's your name?
Yeah, my name is Sean. I'm calling from Akoh.
From where?
Abeokuta here.
Oh, Sean, thank you so much for calling.
Yeah, thank you very much. Yeah,
Please go ahead.
What you're discussing, it's good to see the head of our medical sector in Ogun State seated there. That's FNC. And then the international person also seated there. Now, when I want to say down the attitude of doctors and nurses, you know, the way they deal with patients as though sometimes, as though the patient is so much at their mercy, which is true, but they deal with the patient as God. they harass sometimes, shout on patients, command, people that have come to visit patients, they command them, they shout on them, they harass them, they push them around, they talk as if it's better to this. So, this is not a master-slave relationship, because somebody is ill and needs your assistance. Something needs to be rude or, shut down the person and all that. They talk as if they're not being paid for the job.
All right, Shehu, I want to believe you already made your point. You're concerned about your own perceived attitude of healthcare workers to patients and their family members.
Especially nurses.
All right, okay, fine.
Doctors too share in the blame sometimes, actually.
Okay.
Doctors share, especially when they say an illiterate.
Okay, since we're talking about the Nigerian environment, I will allow the Nigerian man to respond to that. Dr. Shetiberi.
The man also should educate.
All right. All right.
Not like that.
All right. Thank you so much, Shehu. We appreciate you. Yeah.
Well, thank you so much, Shehu. I want to agree with you that these are issues that we have observed over time, and the Nigerian health sector is actually addressing this very squarely. We don't want a situation that the patients will be afraid of those who are supposed to take care of him or her. The issue of attitude that had been on the table for quite some time, and you quite agree with me that things are changing. It's not the way it was about 10-15 years ago that it is now. Actually, the patient is the king in the hospital. You are the customer. Like people say, the customer is the king. It is what the patient. We are all there because of the patient. So when the patient comes, somebody who is in pain, you are supposed to take care of them with empathy. You are supposed to take care of them with love. So things about harassing patients and others are becoming a thing of the past. It used to be that people feel that when you have gone to medical school, you are going to school of nursing, any other person on the other side of the table, you look down on them. But that is no longer the issue. That is no longer the case now. Things are improving. I want to assure you that if you get to any of our hospitals now, the attitude is actually changing, and we really give glory to God for that.
Is Servicom still functional?
Servicom is functional.
So in situations where you feel aggrieved,
then you report to Servicom. Servicom will take it up, and any officer, any staff that has found wanting in that particular will be sanctioned appropriately, and because of that, things are actually improving. Attitudes of people are improving.
Now, Mr. Akoh, Shehu wants you also to share your experience and to educate our medical practitioners.
I think Shehu has raised a very important point. And it's very right to raise this. The interaction between the medical or nursing profession and patients has changed over the years. And I think that there is a lot of room for improvement. We cannot be complacent. We cannot be on the defensive about it. I think we need to educate ourselves to relate with patients a bit better and understand and empathize with patients. Some patients are unreasonable, but those can be dealt with. But whether doctors and nurses, there's really no room for us to be unkind to patients. And the point is well taken, and I think that part of what Dapo has said is true, that the medical profession has to continually improve its own game.
All right, let's take another call. Hello, good morning.
Hello, this is Pastor Bat.
Sorry, please, I cannot hear you. What's your name, please?
Adeleke.
Oh, Pastor Adeleke is calling from where? From where? Ijong. Okay, Pastor Adeleke, please go ahead.
On the issue of bringing emergency care to the hospital, and the nurses and the doctor will say, if payment is not made, that individual will never be treated. What is your take on that?
All right, thank you, Pastor Adeleke. Dr. Shotiloye,
let me quickly take on that. Well, that is no longer the case in Nigerian health sector. We take care of any emergency without asking for pay, at least within the first 48 hours. What is important is actually to rescue any dying patient, to actually attend to the emergency, to make sure that patient is stable, even before you talk about. There are patients that will be brought that you can't even communicate with, but you must take care of them. There are no relations, nobody around to take care of anything. But the healthcare providers must take care of them at least in the first 48 hours to make sure they are stable and we don't lose life unnecessarily.
All right, we have another caller here. Hello, good morning. Hello, good morning. Hello. All right, Oh, sorry. We were actually expecting you to speak, but more calls are coming in. Hello, good morning.
Hello.
Good morning. What's your name, please?
Good morning. I'm Mrs. Sudan on the line.
Cecilia, from where?
From Akoh here.
Cecilia, please go ahead. We have two gentlemen here now who are into medicine.
Please, I want to ask about this National Health Insurance scheme. I'm a customer at Federal Medical Center. So I want to tell you that even what they are saying, I'm listening to what they are saying, that it's not what they are practicing. You will go to that hospital, they will give you the bill. They will, after everything, they will give you the bill. Of ordinary some medicine like the high blood pressure, they will give you a bill of 10,000, and you have to 1,000. Are they helping the sick people or the common people?
All right, Cecilia, thank you for your call. Dr. Shochidoye is here. He will respond to that to ascertain otherwise your claim.
Well, thank you, Cecilia. The National Health Insurance Scheme is such that in Nigeria today, the patient is still expected to pay 10% of whatever drug that one actually is getting from the hospital, and the government takes care of the 90%. I'm sure the drugs we are talking about drugs are quite expensive. If you are paying 10,000, like you said, probably you would have had to pay 100,000 for those drugs. That's the situation. It's not as if the government is not doing, or the hospital is not doing what government is asking the hospital to do. But 10% is like a counterpart funding, so to say, of whatever drug, whatever treatment you are accessing. There are some treatment that are free, but drugs, you have to pay 10%.
Now, just before I return to Mr. Akoh as we coast home here, I want you to do a recap of what you are here for, what he is here for, and his colleagues, level of participation, and the scope.
Well, thank you very much, moderator. Actually, we are happy about what is happening in Abeokuta and starting today, because we have been on this thing for about 4 years and it's crystallizing today. It's a situation whereby we actually have our colleagues in Great Britain coming to Nigeria to actually improve our skills and knowledge. The essence is that what had been a loss to us when our people go to other countries with greener pastures in quotes are now coming back to impact their skill, the skill they have gained, they have acquired over the years to us here, so that we can actually up our own practice in Nigeria. And that is something that gladdens my own heart, and we are looking forward to a higher level of collaboration in this respect. It promises to be something that will benefit all Nigerians, not only those of us in Abeokuta, every Nigerian, whether you're a medical profession or you are an ordinary Nigerian, because when the doctors know what is the latest and how to take care of disease in the latest way, it will impact on the health of the nation.
Now, Mr. Akoh, as we let go of you now, we'd like to take your final words on this program this morning. You are here. For the past 15 years, we've been coming annually to Nigeria to have a feel of what is on ground here, vis-a-vis what is obtainable where you reside. What will be your charge to the Nigerian government, stakeholders, and even the generality of the people with respect to the management of their health, vis-a-vis this platform you are providing for medical practitioners?
Thank you very much for hosting us this morning. The whole idea of the training week has been to make a contribution in a small way to the development of the medical and health workforce in Nigeria, as part of one of our cardinal principles of trying to support, educate, build the health sector in our country. Let me actually pay tribute to the Federal Medical Center, Abeokuta, because as you'd have noticed, this is the first training week. This has been on the boards for about 3-4 years. And I think that the medical director made a concerted effort to get MANSAG to believe that they are serious about interaction between MANSAG and their institution in order to build the medical workforce in this country. And that's why we're here. I must pay homage to the local organizing committee that did a lot of work to make it possible for us to be here. And our experience so far in the last day shows that the hard work they've done is paying dividends. Now, why are we here? We're here to support our people, to build up our people. We're not here because we feel we are superior in any way. We are actually quite humble about it. And hopefully we will interact in a useful way that shows a different way to doing things, that hopefully will bring better benefits and better results in order to improve the health of the people, to build the type of doctors that you need, the health workers that you need. We are trying to engage with the federal government at all levels, and hopefully it will lead to an improvement overall. I can stay here and be citing various things, but I think we're pressed for time. But really to say, we're very impressed with what the FMC Abeokuta is doing, their leadership, Dr. Rufus Akiemi and his team, for all the hard work they put into this. And I'm sure that this collaboration, this interaction will lead to yield fruits in various ways that will benefit the people of this state and the people of Nigeria in general. Thank you very much.
All right, that's how it's going to be on this segment. We've actually played host to two medical practitioners, Mr. Jacob A. Akoh, who is the president of the Medical Association of Nigerians across Great Britain, and Dr. Dapo Shotiloye, the medical director of the Federal Medical Center, Idiaba, Abeokuta. The two of them have actually joined us to talk about the first training week of the Medical Association of Nigerians across Great Britain, which is in collaboration with FMC here in Abeokuta. And the event is taking place at the Green Legacy Resort of the Olusegun Obasanjo Presidential Library here in Abeokuta between today and the 5th of September 2014. Participation is still very much open, I want to believe. All right, in my capacity as a consultant gynecologist, am I welcome?
Yes, you are.
Yeah, you're welcome.
All right, thank you so much.
Any Nigerian is welcome.
We wish you the very best.
Okay.
Thank you so much.
Thank you so much.
Yeah, we'll take another break to bring you another set of guests on New Dawn Otonjo. Please stay with us.